Welcome back to Living Local. Bringing a newborn baby home can be an incredibly exciting experience, but also overwhelming. A lot of time is spent preparing for the labor and delivery, but being prepared for what to expect in the first week and months of baby's life is just as important. The good news is parents don't have to do it alone. Joining me in studio, I have Missy Gowey. She is the Executive Director of Genesis Foundation and Genesis Philanthropy. Missy, thanks so much for being here.
Hey, I appreciate the opportunity.
Definitely. So first of all, what is the Genesis Foundation and Genesis Philanthropy?
Genesis Foundation is a traditional hospital foundation, so we do a lot of fundraising and granting toward things like equipment, nursing education, and different devices, patient comfort items. Genesis Philanthropy is another foundation within Genesis Health System, but it's dedicated to prevention and wellness.
Wonderful. Now, Missy, you are here for new parents and newborns. They do not have to do this thing alone. And one of the programs that you offer is very unique. It's called Family Connects. How does that work?
It is unique to our area. We brought it here from Duke University in North Carolina. We were the first area outside of North Carolina, as a matter of fact, to bring the program to our community. And what happens is we have a specially trained nurse, a visiting nurse, that goes into the home of a newborn baby within about the first 3 weeks that the child has arrived at Genesis. So we go visit all the Genesis babies.
And what does a visit look like when they go there?
It's a lot different than what I experienced when I was a new mom. And I can tell you, it is a critical time to have somebody come in, because when you leave the hospital, you leave with the baby, you don't leave with the nurse.
Right.
So to have a nurse come into your home and sit with you and talk about what you're experiencing as a mother, how the child is reacting, the child's physical health, your physical health, but it's a whole lot more. It's more than weighing baby, weighing mommy. It's taking a look at the environment that the child is in. So for example, is this your first baby? Is it your fifth baby? This makes a difference. Did this baby come home with some special needs that the other child did not? Are you raising pets? Are there other children in the home that might be jealous of new baby? Or what does the sleeping environment look like? And how's the baby been so far? And how is nursing going? There's so much involved with that first visit that it could take an hour and a half, 2 hours, where it's a very intensive time to talk with mom and dad or other caregivers in the home as well.
And then how many visits does the nurse come in and do after that first initial one?
It depends. We can go in up to 3 times, and we can also offer lactation advice and consultation even before the nurse comes to the home to visit with the baby and the mom and dad. We like to be able to go back if there is an issue or a concern where we can visit with the parents and see how things are going. But we also have a great other part of visiting nurse opportunity here, where we connect the family with other resources. So if you are experiencing something that you think you're all alone, no one else is experiencing this, and perhaps you don't know what agency would offer help in the community, that's the time that the visiting nurse comes to you and says, hey, there's some other agencies that could help you with that particular issue. Or if you're concerned about child care, if you haven't connected with a pediatrician, if you have questions about vaccinations, all of that can be done during that visit.
Wow, so you guys really cover everything.
We cover everything. Well, I can remember myself, when you're at the hospital, you have a lot of visitors, you're excited, you have the baby in with you. At night, perhaps the baby goes back to the nursery. And you know how to do the simple things, the basics, to take baby home. But you may not, at that time, be thinking of all the questions. And maybe you think, this isn't the same baby that was at the hospital. This baby all of a sudden is crying more or has difficulty eating or latching on. That's a great time to have somebody come in, a very trusted nurse come into your home and say, it's going to be okay.
Right.
You're going to be a great mom and your baby is doing just fine. The other thing that we're looking for when we're in the home is postpartum depression. There are a lot of women that may not recognize the signs of postpartum depression. So we have an opportunity to go in and use a screening tool and help that mom understand what they're feeling, and if it is signs of postpartum depression, that we can get that individual connected with some help.
Wow, that is incredibly valuable to new moms out there. So this is the first place that you guys, it's left North Carolina and here in the Quad Cities. How did you guys become aware of this program, and what made you want to bring it here to our community?
It was the Visiting Nurse Association at Genesis, and they had been working with Scott County Kids for some of the funding, which we still receive. They're a great partner. And Scott County Kids was asking for evidence-based programming. We had a home visit program before, but obviously you want metrics to prove that what you're doing is actually very valuable. So they did the research and found this program at Duke University, went for the training, and then we became licensed. And I know it's gone to other areas of the country, but as you say, we were the first. And they did a lot of research and study into how effective the program is. Every dollar spent, it was a $3 return in savings. It's an incredibly effective program. The other part of this program that we see as very valuable and effective is we're able to get in with new parents and talk about proper care in emergent situations or non-emergent situations. When is the proper time to take the baby to the emergency room? God forbid that that would be happening in your home. We've reduced the number of emergency room visits for children, infants under age 1, by 27%.
Wow.
That's since the beginning of the program over the last 3 years. So we're very pleased by that figure. And we also have seen a reduction for 1-year-olds, and overall it's been over the 3 years up to age 3 about a 15% reduction in the use of emergency rooms.
So the numbers are showing that this program is working.
Showing.
Okay, so over 3 years, what kind of feedback or outcomes have you seen? And obviously one of the outcomes is the numbers, but just feedback from new moms who have gone through the program.
They love it. They absolutely love it. I think it's that reassurance of, you're a good mom, you're doing okay, or you're a good dad, you have a baby in a stable environment. I think they also like and appreciate the fact that we're looking at the entire home environment, and we're looking at how the parents were raised themselves, because that has a lot to do with what kind of parent you're going to be, depending on the type of home that you grew up in. We did have an incident too, speaking about home safety, where the nurse was with a family and found a gas leak in the home.
Wow.
Yeah. Wow.
Oh my gosh, I just got chills.
Yeah, that
That's
could have been
insane.
devastating for
Absolutely.
that family and for our community when you think about it. So if you can look at the whole environment that the child is being raised in, beyond just the physical health. The other part of this is helping parents with that attachment to baby, being able to explain the importance of reading to baby and cuddling with baby and feeding habits, those types of things. We also deliver some things to the new mom. Yeah. For example, there's a book in every bag, maybe some lotion for mom as you're starting to feel a little bit more like yourself or want to feel special and pampered maybe just a little bit when you get home. So you get a folder full of resources, you get the assessment, you get a book for a baby, you get lotion for mom. It's an incredible program. We're very pleased by it.
Wow, incredible, Missy. And in addition to Family Connects, you also offer the Sleep Sack program. So how does that work?
This is a sadder thing. We have a Sleep Sack program because there was a baby, Elizabeth Grace Atson, who died from SIDS. And when her parents wanted to take something very positive from that tragic situation, they decided that they wanted to make sure that other people didn't have to go through the heartache of losing a baby to sudden infant death syndrome. So one of the ways to protect a child from that is a sleep sack. And I brought you one today. I don't know if you'd ever seen a sleep sack.
I have, yes. I'm not super familiar with how it works, though.
Me neither, because I didn't bring a baby home in a sleep sack. But I know that it's a way to swaddle baby. And when I was raising my children, I remember there were bumpers along the crib, and you'd put tons of stuffed animals in there, and there were blankets, and sometimes you barely could find the baby because you had so much stuff in the crib. That's very dangerous. Babies should be swaddled. They shouldn't be having a loose blanket over them. There shouldn't be crib bumpers, animals with them, anything. It should be baby swaddled tightly, but comfortably, obviously, in the crib, lying on his or her back. Well, we want to make sure as a foundation that every baby that leaves Genesis goes home with a sleep sack so that the parents can have safe sleeping habits for the child. We raise money for these, and we make sure that just for $9, every single little infant that leaves our Genesis hospitals can have one of these to be swaddled. Baby's arms can be under the chin, wrapped tightly, even free. So it's a very versatile item that we love to send our babies home in. And when our visiting nurses go in for the Family Connects visit, they again check to make sure that the proper sleeping accommodations are being made, including using the sleep sack.
And
so it all fits.
Yeah, definitely. And the Sleep Sack program, the Family Connects program, having incredible impact on our local moms and newborns. So how can people support these programs?
Go to our website, genesishealth.com/give. Just think about it. What do you spend on a pizza? What do you spend every day in your life that you could help protect a baby with a $9 gift? Or you could do something as a family in celebration of a new baby in your family or a new grandchild. Make a gift to the foundation so that you get at least one family receives that visit from a nurse. These are charitably funded 100%. So we need to support these programs. It's a way of just extending support into families in our community.
All right, Missy, thank you so much for the information.
Thank you.
We appreciate you. All right, for more information, you go online to genesishealth.com/give or contact the Genesis Foundation or Genesis Philanthropy to make a gift in support of these very important programs. We'll have these details posted on ourquadcities.com. Stay with us. More Living Local rolls on after this.